My name is Dr. Kevin Pecca. I wanted to make a podcast that exposes people to the true miracles of life and health. All the guests on this show have been specially picked because they bring something positive to the world. They have some of the most amazing and inspiring life stories. These people have a passion for living, healing, and leaving the world better than they found it. There is something inside these people that made them keep fighting through all the tough times, even when people told them it was not possible. They carried on and made their lives beautiful again. And now they are sharing their experiences with the world. This is the Expect Miracles podcast. Enjoy the show. NAD IV therapy is an emerging vitamin therapy that is all natural, holistic, and has shown outstanding results with people suffering from addiction, age-related diseases, and chronic fatigue. NAD IV therapy is not yet approved by the FDA, and further research needs to be done. Tom Ingoglia reached out to me last week saying NAD therapy saved his life, and now he is on a mission to spread the good word about NAD IV therapy and help as many people possible suffering with addiction, chronic fatigue, chronic pain, and much more. As I stated before, this has not yet been approved by the FDA, so anyone looking into this type of treatment must do their research first. And please welcome Tom Ingoglia. So Tom, from what I'm reading and hearing, you have a pretty amazing life story that I can't wait to get into, but just a little information about yourself before we start. Who are you, Tom, and what do you do?
I was a finance guy. I was a financial trader who got very sick and lost my ability to really function.
How long ago was this?
This was back in 2007, 2008.
Okay.
And I was sick for about 8 years, and I found a therapy called NAD, intravenous therapy, and it absolutely rocked my world.
Yeah.
I'd gone down this journey of trying to figure out what was wrong with me, and it was just an incredible journey, a very lonely journey.
Oh, absolutely.
And then when finding NAD therapy, it also became a little bit lonely too, because I found this amazing therapy that no one knew anything about.
Yeah.
I never expected to fully recover from my health problems. I had totally given up, and it fully reversed everything.
Yeah.
And then some.
Amazing. Yeah, I was in the same boat, probably different story, different situation, but I was in a rut for about 4 years, and I never thought I was going to live a healthy life again. So it's always a breath of fresh air talking to somebody that's come out the other side. So, Tom, what is NAD? For those who have not had a biochem background at all.
I don't have a biochem background either, so this will be really simple.
Good, okay.
NAD is Nicotinamide Adenine Dinucleotide. So that's why we call it NAD, and it's an energy-carrying molecule. It's a coenzyme that's ubiquitous in all living things. It's essential for all life, and it's used in so many different things in the body. The Krebs cycle, for example, it's used in hundreds of redox reactions. It's used with this enzyme called PARP, which is poly-ADP ribose polymerase.
Yes.
That's one of the main mechanisms by which cells correct their DNA damage.
So it's a cell repairing facilitator, right?
It's a DNA, in this regard, it's correcting actual DNA breaks. So a typical cell might have 50,000 DNA breaks per day. NAD is essential, a part of that DNA correction process.
Amazing.
And that's like one of the main priorities of NAD. NAD activates these key proteins involved with longevity and anti-aging called sirtuins that turn off various parts of DNA and do a host of other things.
So it's a strong antioxidant as well then?
It is. It's a very strong antioxidant. NAD is a neurotransmitter. There's very little information on that. And NAD is a sort of precursor to other neurotransmitters in the brain. NAD's for every molecule of alcohol, you need 2 molecules of NAD to get rid of the molecule of alcohol. And then NAD is essential in these internal clocks in our body that regulate circadian rhythms and sleep.
Wow.
And then finally, it helps reduce something called glutamate excitotoxicity. Quite often, cells get too much glutamate and it could devastate the cell itself. So it's responsible in a metabolic pathway that digests, that metabolizes the excess glutamate. So the long story short is that NAD levels decline with age across species, and those declines are associated with aging. And we're finding out more and more that this is sort of a causal link. This is like the sole reason why I'm involved, because I feel like something happened to me on a sort of something on the aging scale.
Really? Okay.
Yeah.
So what exactly happened to you? So you were working finance.
So I was working finance. I have a farm in Costa Rica. I went down and I came back and I just wasn't the same. And I thought maybe I got an infection or a bug or something.
Right.
Went to the doctor, asked him for some antibiotics. And then I went downhill from there. But, looking back, I did test positive for Lyme, and I'm pretty sure that I had adverse reactions to the antibiotics that I took. And so there's known adverse reactions that occur with fluoroquinolone antibiotics like Cipro, Levaquin. There's a lot of adverse reactions with Flagyl too. So I was taking that as well. And these are just very, very hard cases. It's very hard to find a doctor that really knows what they're doing. And NAD is actually a little bit hit and miss with handling a lot of these cases of adverse reactions. It had been many years. I was on opiates for a number of years. Looking back, when I had gone to an addiction conference to study up on addiction, I realized, because I'm not really an addict. I'm not really someone who likes to, partake in those kinds of things. And
so back up a little bit, because did you have just pain all over your body?
Yeah, I had massive chronic pain.
So So you had massive chronic pain all over your body that just showed up out of nowhere.
It would come and it would go. It would come across my whole body and it would go. And there was little peculiarities about it. I would get muscle pains in my quadriceps. I would get tendon and ligament pain in my feet and my hands. I would get pain after exercise. I would get headaches. I would get headaches after staring at a computer screen for just a short period of time.
Yeah.
I had trouble standing for more than 30 minutes at a time. So it immobilized me. The pain immobilized me. I must have spent maybe a couple years in bed. That's just the pain part. There's the fatigue. There's the mental fatigue, mental clarity.
And you're running around so you're running around at this point, seeing any doctor you can that can help, like the medical standard traditional route. And what are they telling you? You have Lyme disease, and
I went to the Mayo Clinic, and they asked me. They're kind.
Yeah.
They're intelligent. They're educated, and they asked me, like, "What do you think you have?" And I said, "I think I had an adverse reaction to antibiotics, and I think I contracted Lyme." And this was at a time when the warnings on fluoroquinolones weren't there. And they said, "You know what? Like, I don't care what you read on the internet.
Yeah.
It's not something we look at." I'm like, "But there's thousands of us."
Yeah.
And eventually the warnings came out. And
you're talking about the side effect of the antibiotics?
Yeah.
Yeah.
So there's a range of things, and it's heartbreaking to hear about some of these people that get central nervous system damage, anxiety, insomnia. I had a mental breakdown because the stress was so intense that, I really couldn't, I had, they call it adjustment disorder. I asked them, what is adjustment disorder? It's like, well, you're in a mental breakdown. So,
yeah.
It was up until I lost a couple friends who were addicts. And then a couple weeks later, I lost half my family in a car crash. It was an instantaneous head-on collision that sort of rocked my world and brought me to a new low. And at that point, I think I was always very much going to beat this thing. But at that point, it's like there was a massive shift in terms of really focusing on and really getting to the root cause of what this could be and just taking my health into my own hands. I was already seeing integrative doctors and naturopaths and chiropractors. I was already going the alternative route. I knew at that point that was the way to go for chronic conditions.
So you're pretty much at, what is it, a couple of years that you've been feeling like shit?
I think it's been since 2013. So
okay. Well, I'm just trying to get a timeline here because you're just at like one of the lowest points of your life. And then what did you just get a phone call one day and half your family just like died in a car crash?
It's unbelievable to explain. I called my brother about our friend that just killed himself, and he told me that the car crash happened. And I didn't even.
You were calling your brother to tell him that one of your friends passed away, and he came back with, by the way, oh my God.
Yeah. Essentially, I wanted to comfort him about our friend who he killed himself in a very public way. He was suffering from psychosis, from a history of using methamphetamines. And there was nothing we could do when we were young to help him. And it's had a huge impact. Even though I hadn't seen him, it's had a huge impact on what I've wanted to do with my life.
Yeah.
I think when you go through so many of these things, you really question what is life all about.
Oh, absolutely.
And if there's anything that you can do. And I think that for me, it was, there was some reason for wanting to move on, and I was going to find out what that was.
Yeah.
And I think that's NAD, honestly. I did the protocol, which is, it could be 6, 8, 10, 15 days of intravenous, an IV drip, not expecting to come off of opiates, which I was addicted to.
How did you find NAD? Like, what made you say, I'm going to give this a shot? Like, who presented it to you? Because I've never heard of the therapy, and just curious on, like, who brought it up to you, and how did you say, all right, let's give it a shot?
So I spent quite a bit of time online doing research, and I spent time with other people that were sick, asking them questions and asking people and just digging as deep as I could.
Yeah.
I hate to say that there's a lot of resources and people that might not have a medical background, but when there's hundreds and thousands of them,
right.
I mean, you could glean a lot from that. And just doing the research, I kind of came to the conclusion that this was a mitochondrial or cellular problem at its core.
Yeah.
And that NAD works on the mitochondria, and that it was something I was willing to give it a shot. It was get healthy or die trying. And so I called them up and I said, look, I want to do NAD. And
who did you call?
I called someone in San Diego that had an NAD practice that they no longer have it. And I asked them, I said, I want to come in and do NAD experimentally for a mitochondrial dysfunction.
Yeah.
And they said, okay, but this is totally experimental.
There's no research behind it yet.
There's nothing that, even right now, I mean, the FDA took it off of it's like, they took it off of grass this summer, generally recognized as safe food. It's not approved by the FDA. And by the way, I'm not a doctor, and please seek medical advice. It's not approved for anything, and your results vary. So I came in to do it, and they said, well, you know what? We're going to want you to come off opiates while you do it. I said, well, I'm not an addict. And it's like, well, it's not a problem then. And it's like, well, I didn't come in for that.
Yeah.
And they're like, well.
So you weren't expecting to come off the opiates yet. You just wanted to kind of get,
I wasn't an addict. I was just someone who was in physical pain.
Yeah.
I didn't understand substance abuse. We now know that opiates create pain.
Oh, absolutely.
I mean, no one was talking about this before. This was not a conversation that I had with doctors.
Right. But knowing what you know now, were you like, obviously you're in an excruciating amount of pain. You'll do anything to get rid of the pain. Do you think you were abusing the opiates just to feel pain-free?
I didn't take it recreationally or to numb myself. I took it because I was in physical pain. And when I didn't have pain, I didn't take it.
Right. That's what I'm saying. Okay.
But there's something called opiate-induced hyperalgesia. It's a sort of fibromyalgia from taking opiates long enough.
Yeah.
And I did everything. I mean, I went to a chiropractor. I had my fibromyalgia is linked to, cervical spine, for example. It's linked to so many things. And I went and checked off the list.
Right. You were doing anything you could at this point, yeah.
Yeah, I was going down the list, and I really thought that there was something going on the cellular level. So I did it. We don't really know when you're going to feel it. Sometimes it's day 5. It really depends, but most of our people feel it around day 5.
Mm-hmm. What's the regimen like? Like, is it one IV bag a day, or is it?
It's one 500 ml bag, 1,000 ml bag per day. It's tedious.
Yeah,
you're in a comfy chair. You got internet. You might be watching a movie. I mean, you're sitting there and you're going through the motions. It's like taking a transatlantic flight in first class. Yeah. But boy, is it totally worth it, because I mean, I was crying around day 6, day 7, and then my friend, he comes home and
crying like in so much pain, or
because I didn't think it would work.
Oh, so you're like, all right, this isn't working. Around day 5, 6,
it's not working, and I was a mess. And he said, well, let's go in the ocean. So we went out in the ocean, and then I was out there in the water, just sitting out there floating, and all of a sudden it just totally hit me.
What hit you?
Yeah, I mean, it can hit pretty fast.
What did you feel at that moment when it hit you?
It was just a feeling of peace.
Yeah.
And at that point, it was like a change in consciousness.
Yeah.
And it was something you'd never forget, because I felt like time slowed down or something. It's not something you can articulate.
Right.
It's something you just have to experience.
Absolutely.
The next day I woke up and I was feeling pain again. So I was really, at that point I was like kind of pissed off, because like, oh, I guess this didn't work. And then the next day after that, I was symptom-free on day 9, and they said, well, we don't know what's going on with you. And I said, no, this is working, because if I have a fibromyalgia hangover, it lasts weeks, but I've recovered in a day. This is something's going on. Like, this is working. We got to keep doing this. And so I ended up doing a couple extra days. And what had happened was I started getting massive energy. I started sleeping better. My pain was cut by 50% at that point, which was massive, going from an 8 to a 4 or to a 5. Now I felt like I can walk around. I felt like I could stand more. Here's a person who's at the supermarket and I need to use the shopping cart as a stroller.
Just to stay up.
Yeah, just so I'm not putting pressure on my feet. But what I felt was, because I also suffered from brain fog and my clarity started coming back.
Yeah, that was one of my worst symptoms, the brain fog. It's scary. It's a very scary symptom.
Yeah, absolutely. And so my pain, clarity came back. The coolest thing about NAD so often is we get people who can think longer. You don't get as tired out when you're thinking.
Your attention span is just it increases and you're clear and like.
When you have mental fatigue, it's like everything is an exam. There's mental exhaustion. I've gone from not being able to keep up with people to being able to just keep on going. And that was the coolest dividend. And it's like, well, Tom, the IV takes 8 hours. It's like you're going to be so productive that you're going to make up for that lost time within a month.
Yeah.
So
are you able to work at this point? Did you have to quit your job or?
Well, being sick is traumatic. I'm an investor. My finances were doing well. I spent a whole nother year sort of recuperating, trying to figure out what my next thing was that I was going to do. The one thing that they said was, why don't you come in for a booster? And so I come in for boosters every 1 or 2 months. And I noticed that
is this now?
I'm actually getting a booster tomorrow with
what's a booster?
Okay, so they said, hey, you want to come in for boosters? This was after I was done. And I said,
this is the clinic you've been going to that administered you the NAD at first? Who are we talking about? This is the original treatment? This
wasn't the original treatment center. This was another center. I said, I thought this was sort of a one and done thing. And they're like, yeah, it is. It is. When you're going this many days, it has a sort of, it tends to be one and done. Your mileage is going to vary. But what we see in a lot of people is that you level up when you take a month off and you come in for boosters. And I'm like, so what you're saying is like, I feel awesome. And what you're saying is that if I come in and get a booster, I'm going to get to the next level. And they're like, usually that's what happens. If you got more to go, do it. And I said, well, I'll come in and get boosters until I can no longer level up. So there was a couple of years I was coming in 1 to 2 months getting boosters and I felt like I was leveling up each time.
Yeah.
But we get a lot of people that don't come back.
That's almost a good thing, right? Like, because they're feeling better.
Yeah. They're fine. They feel like they've maxed out and they feel like that they've got their money's worth. Then we get some people that come in, but generally speaking, when you ask someone, how do you feel after a year? Most of the time they say, man, it's been amazing. Like, I felt better a month after than when I left the treatment. I felt like 2 months, after 2 months or 3 months, I felt even better.
So, Tom, is this an addiction-based treatment, or can somebody that has fibromyalgia go and get treatment, or is very sick, or is this right now? Is it only like, is it addiction-based, or how does it work?
We see the best results with alcoholism and with opiate addiction.
Gotcha.
It's like really amazing results.
Now, does not only does it get you pain-free, does it like almost rid you of the craving?
Yes. What we see is a lot of people report that a minimization of craving. And my mother, she's a social drinker. She came in to get NAD for anti-aging reasons. And she just said, I feel great. And I don't understand it, but I don't drink anymore.
Really?
Explain. she's like, I don't know. It's just, I don't need it anymore. I don't want it. I don't want that in my life. But what we see is that people will come in with chronic conditions, whether they're on the anxiety spectrum or it's depression or it's chronic pain, and that you see some results.
So you will take somebody that says, if they call your clinic, they say, I have fibromyalgia or I have intense headaches or I have severe anxiety and depression. You take those people as well.
Yeah, we do.
Okay.
And we see, it varies. I mean, like if someone has a spinal injury, you have to talk to them about the root cause. You'd still want to deal with the root cause. And I think very much for me, as an example, the root cause was at the intracellular level.
Absolutely. So how long did it take you from your first NAD treatment to start feel like you look in the mirror like, oh, wow, I'm pain-free? Like, how long did that take?
For me, I mean,
because it's a healing process, right? Like everything is a healing process, and it very rarely happens overnight.
I was a late bloomer.
Yeah.
And so for me, we didn't think it was going to work. And then it worked at the end. And then it took me a whole nother year where I announced that I did a little Facebook post. It's like, I've totally recovered.
That's what I like about that. I mean, because you hear a lot of people saying, take this pill and overnight it's going to work. And a lot of people want that quick fix. But I think if you're doing anything that's sustainable, and the healing process is a process, it goes up and down, up and down. So anytime I hear someone saying, oh, I took this one pill or something and it worked right away, I never had it, it's like, I have questions about that. But I like how it was I don't like how it was a process, but I think anything worth doing, any treatment it's definitely up and down. It's got its valleys and it's got its peaks. It's definitely a wild ride, but it definitely stabilizes you after a while.
Yeah. If this is something important, I mean, how many other things out there that we're just overlooking? And if we combine those things, maybe there's something that we get a much greater impact. And so that's why I wanted to get involved. And I have a nonprofit that studies NAD and longevity, NAD and addiction and brain health, and looking at other therapies that we can combine with it. And then also I do the back office business administration at the NAD Treatment Center. And we try to apply some of that research to the therapies that we're currently doing. And my nonprofit is also hosting an international conference on NAD. It's coming up in the next 8 days. So now I'm sort of a spokesperson for this therapy, getting the word out. What really turned me was 6 months after my 12-day treatment, David Sinclair, a well-known longevity scientist, came out and he rocked the scientific world, where he had a journal in Cell, December 2013, that said essentially he was able to turn back the biological clock in mice through NAD administration. It turns out it was a precursor called NMN through these injections. So when I saw that, I thought 7 days of NAD therapy, and you're seeing, and what he was able to say was they were able to see the tissue of human equivalent 60-year-old mice to 20-year-old mice.
Wow.
At that point, I was thinking to myself, I think I've been a guinea pig in this amazing journey, this amazing therapy that's going to become something very big. And at that point, the scientific community really
getting the scientific research and backing now.
Yeah, I mean, that really sort of exploded. I mean, it was mentioned by Lenny Guarente years earlier, the mentor for Sinclair over at MIT, but it's a big thing at the NIH right now, at Harvard, internationally. I look at some of my old tests. I mean, I did some really strange tests when I was sick. I did a DNA breaks test, and I noticed that my DNA was in the top 1% of. I don't have a before picture of my DNA, but my after picture shows very minimal nuclear DNA breaks. And then there was I did a telomere length test. My median telomere length was that of a 12-year-old. It was actually off the charts, but you're only as young as your oldest telomere. So I'm 43 and it was 35-year-old telomeres. And so it was it's all this stuff that I was looking at, and I was thinking to myself, I got to get involved. I got to do something about it. And it was sort of killing me, every moment that I wasn't involved in this sort of scientific or movement around NAD. And so I just had to get involved. Beautiful. And I ended up meeting some scientists. He told me that you've reversed your age as we were talking, drinking coffee.
Really? Yeah, you look pretty. I mean, honestly, if you didn't tell me you were 43, I was going to say 32. You got the...
Preparing for this conference has aged me, so I hope I can reverse my age after this conference.
So, Tom, how does it work with treatment across the country? Can somebody in New Jersey get treatment over there, or New York, or is it just California-based right now? Or
there's a couple treatment facilities, one in Louisiana, another one in Florida. But out here in San Diego, I mean, we try to really focus on this art of doing NAD treatment. NAD IV treatment actually was started in the early 1960s. Yeah, by a famous doctor, PhD, Abraham Hoffer. And he wasn't the only one, but he was this sort of larger than life person that takes a lot of the credit. And he was one of the first scientists to be a huge proponent of niacin. So he was the niacin pioneer, not counting Joseph Goldberger in the 20s and the turn of the last century with the epidemic in pellagra. But yeah, so he experimented with NAD. He worked in an insane asylum.
They were using niacin to treat depression, weren't they?
Well, he was using niacin to treat schizophrenia.
Okay.
And there was a huge backlash against him as he was trying to do this.
Was he getting results?
He was getting results, but Hoffer was this amazing guy. I mean, he was also using other therapies as well, and he was, charismatic, and he was so intuitive that his results weren't getting replicated. But I mean, he had 17 patients that rid themselves of extremely difficult things, mostly schizophrenia, who they got their lives back together. There were 17 of them, got their lives back together and went to college and then medical school and then became psychiatrists like him. I mean, that was just 17 that became psychiatrists. I mean, he had his track record with schizophrenia there's books written about it. I mean, I'm not going to say anything. I'm at our center. We don't treat for that. And there's so much, the word, I mean, like, you can't do it, basically. You'll get in trouble. You'll lose your license.
Okay. Gotcha.
Yeah. I mean, it's something you can't do.
So Tom, what have you seen, some of the miracles that you've seen in your center that,
I've
San Diego that you've been treating, and cause you've been pretty newly involved with this, and you get to help other people get through this. So what have you been seeing?
I've mostly been involved with the marketing efforts, but there was one patient that woke up from a catatonic state, but there was issues with her keeping up with it. I met one guy that had full remissions of their Parkinson's disease.
Wow.
And there's generally an improvement. We've seen a general improvement in Parkinson's. That's promising. What if there's other therapies that can really knock it out?
Yeah.
Again, though, it's like there's such a lack of research, a lack of funding, and that's why I wanted to help fund this research.
Yeah.
And especially with addiction, too. I mean, NAD's starting to get linked to so many age-related diseases. I mean, we already know about heart disease. I mean, that was something that Hoffer did. He was such a huge proponent of NICE. And I mean, he was the first psychiatrist to do a double-blind, placebo-controlled study in psychiatry at all on the planet. There was still so much of a backlash,
Mm-hmm.
It's not safe. It's not the thing. And so the powers that be had sort of pushed that off. And he said, it's going to take 50 years for NAD therapy to be accepted. And so we're at about the 50-year mark. And I think this is the moment it's going to happen. I mean, there's an Academy Award-winning producer that's coming to the conference to do a movie about NAD and life extension. I think that the moment where Hoffer gets vindicated is starting to happen, but it's not just about NICE and it's not just about B3. It's about the paradigm that we can use natural substances that correct the root cause instead of synthetic things.
Well, that's the problem. Our medical system, it goes after where the smoke is and the symptoms. They're treating the symptom. They're not treating the root cause of the problem. So any type of therapy, whether it be NAD or upper cervical chiropractic or anything that's going after the root cause of the problem, that's where it needs to be, because our healthcare system it's a mess. We're almost taught to do the opposite. Go put all these drugs in your body, see if they work, and then go seek alternative treatment. By the time those people get to us, they've been through hell, and it's a long time, and it's sad to see. So anything that's going after the root cause of something, I'm a huge fan.
So, Bill Falloon at Life Extension, he spoke at RadFest, the Revolution Against Aging and Death. It's a place where, sort of the nerdy lay people and scientists get together and we talk about radical therapies and anti-aging. And we had a booth at that conference, and it was where he was able to talk about NAD, just ironically, the NAD infusion that he had and the response that he got. I mean, here's a guy that has no medical problems. He talked about just the amount of energy that he'd gotten from it. And we think that we're going to see a lot of data coming out about DNA breaks and DNA damage and sirtuin effects and telomere length.
Do they have before and after pictures of people's DNA, like telomere length and like the strands looking better than like pre and post? Do they have that data yet?
None that I know of. I think that some of that stuff is going to be coming out. We do have that in the works and research at our center, but I'm not fully abreast at that so far. The science is still unfolding,
right? But
the anecdotes are there. Where if you go to nadtreatmentcenter.com and go to the testimonials, I mean, you find people that are they're completely overjoyed. They're in tears saying
absolutely.
That we get a lot of people that say it was the greatest experience of their life, going through a detox.
Right. But before you said like your DNA looked better than it did, what are they using?
Just to correct you, I didn't have a before shot.
You didn't have it before, but you had after, and it said your DNA looked good, right?
It looked incredible.
Do you know what they're using?
I could, look at that and back to you, maybe
right, okay.
Post the link for that. I've tried to contact that lab and they haven't gotten back to me.
Gotcha.
But, we're going to be working with scientists to hopefully get the funding to do this research.
Definitely.
So
Definitely. So it sounds like you guys are off in the right direction. Really excited to what the future brings with NAD. Sounds like it's very promising.
thank you.
Definitely. So do you have any advice for people that are just struggling with addiction and stuff like that, and where because there's so many people that suffer with that, what they can do to get back on their feet? And
Yeah, I mean, drug overdose is the number one cause of death, 18 to 60. I mean, it's appalling that we haven't done enough for it. When Hoffer was Bill Wilson, the founder of AAA, when he was his doctor, Hoffer advised him to take niacin. And then Wilson wrote him back and said, hey, I feel amazing. I mean, I've been sober for years, but never felt normal. I felt depressed, and like this has really changed me.
yeah.
And niacin being a precursor to NAD. Mm-hmm. And so he saw his results get better. And then, of course, he shared it with his friends who were also, his sober friends. And he had 10 out of 30 felt it in the first month. The second 10 out of 30 felt it in the second month. And then the third 10 didn't feel it. And yeah, I mean, of course, Bill Wilson was still going. He was still going to meetings and doing other things. I mean, it's like You don't just do one thing, right?
Yeah, yeah.
But what Hoffer was seeing was amazing results with the IV NAD. But it's very hard to synthesize. His supplier stops supplying him, and then that was sort of the end of it. It was just sort of archived, and it sort of went underground at that point. And there was just very little, if any, NAD therapy going on around the world. But it managed to stay alive and then make its way back to the United States.
Gotcha.
But what can you do? I mean, at our center, we have NAD injections, we have NAD patches. They're a little bit more expensive. But what we see anecdotally is this sort of one and done effect, this like change of perception, where you're not really ever the same through the IV NAD. I mean, it's like order of magnitude. It's several times higher. But also, I mean, nicotinamide riboside too. So, but your mileage is going to vary. It really depends. It's going to depend on you. But we see very high rates of satisfaction with the IV treatment. I mean, it's expensive, but there's other things you can do. I mean, so for example, you can take nicotinamide riboside. There's a tea called Pau-d'Arco that's helpful.
And this all has the NAD in it?
Well, Pau-d'Arco, it works on a gene that helps salvage NAD. So you're going to recycle your NAD stores in your body twice per day. You're constantly using it and then recycling it. And so that in that regard, it's working on that. NR is 2 metabolic steps away from NAD. And then also exercising helps with NAD, getting adequate sleep, and avoiding alcohol. So even one drink of alcohol can disrupt the changes in NAD during nighttime that you should normally be having. But intermittent fasting.
I'll do that. Intermittent fasting is great, yeah.
It has an incredible effect.
Definitely.
On NAD. Very, very doable. Yeah. I mean,
that in itself, they say, does some cellular repair and strengthens that, and it's got a lot of great help.
And it works on mTOR too. I mean, so it's working on at least two mechanisms.
Definitely.
But yeah, NAD is going to, certainly it works on intermittent fasting certainly works on NAD, building NAD stores as well. So, I really think anybody that's over 50, should come in and get NAD, do some of the other therapies that we're looking at for anti-aging, age reversal. And, especially if you have certain red flags that come up, like fatigue and pain and addictive tendencies. I mean, it's just now you're starting to see, wow, I mean, like NAD could really be something that could be helpful if other things haven't worked,
Right. Yeah. So, Tom, where is your clinic located? What's the name of it? And how can people go in and see if it works for them?
So it's NAD Treatment Center. NADtreatmentcenter.com is the website. We're in the middle of San Diego, like 15 minutes from the airport. It's beautiful out here. There's no winter.
Ocean Beach is like my favorite place on the planet.
I'm in Pacific Beach. So that would be, I think, a great option. That's where we're in the conference is on the beach as well. If you get this podcast out soon enough, maybe there'll be some people that come and fly. And it's mostly doctors and scientists for this conference that's coming up.
Yeah.
but anybody's invited to come.
Well, Tom, I'm really excited for you. Thanks for sharing your story. It's an amazing testimonial. I'm so glad you got your life back and you're doing well again, and you found something that you're passionate about, and you're helping so many people. And that's really what it's all about. And thank you so much for coming on.
Thank you too. And thank you for letting me share my story.
Absolutely. And yeah, keep us updated on the research and anything new pops up, and just keep in touch, because I'm curious to see, I know something beautiful is going to come from it. So just stay in touch, and thanks again.
Thank you.
Thank you everyone for listening. My private practice is located in New Jersey at Montclair Upper Cervical Chiropractic. If you have any additional questions about today's podcast, other episodes, or any questions about Blair Upper Cervical Chiropractic in general, feel free to visit my website at drkevinpecca.com or subscribe to my YouTube channel at Dr. Kevin Pecca. Hope you enjoyed the show. Cheers.